Have you ever really wondered what happens after they ask you to count backwards from 10? For most of us, general anesthesia is just a black box. You're there 1 minute, and then you're not. So today, we're going to pull back that curtain and take a look at what's really going on during one of the most incredible processes in all of modern medicine.
You know, it's the question pretty much every single patient asks. I'll be asleep, right? And it's a fair question, but honestly, the word asleep doesn't even begin to cover what's happening. This isn't just a nap. It's a profound, medically induced state that's way more complex and way more controlled than you might think. See, here's the thing. General anesthesia isn't just one thing. It's actually four. You've got pain control, which is analgesia. You've got amnesia, so you won't form any memories of the event. Areflexia, which means no movement. And of course, unconsciousness. The real art and science for an anesthesiologist is creating this delicate balance of all four of those states and keeping it perfect for the entire surgery.
In that whole journey, it doesn't actually start in the operating room with all the bright lights and machines. No, it begins way earlier, with a really important conversation between you and your anesthesiologist. This is where the custom plan for you is actually born. A really key part of that talk is making sure everyone's on the same page about the plan. People often mix up sedation and general anesthesia, but they are worlds apart. With sedation, you're sleepy, you're relaxed, but you can still breathe on your own. General anesthesia, though, that's a whole other level. You're going to be completely unaware, and a machine will absolutely have to handle your breathing for you. And I love this analogy, thinking of the anesthesiologist as a chef, because there is no single recipe for anesthesia. It's not one size fits all. They look at the type of surgery you're having, how long it's going to take, your specific health history, and they create this unique cocktail of medications that is tailored perfectly just for you. Okay, so let's move into the operating room. Long before you even roll through those doors, the anesthesiologist has been in there meticulously getting everything ready. This whole phase is about building a fortress of safety and preparing for literally any possibility. Anesthesiologists live and die by their checklists, and a classic one is called MS-MAIDS. You can think of it as their version of a pilot's pre-flight check. It covers everything from checking the anesthesia machine itself to making sure suction is ready to having every single drug drawn up and labeled. It's systematic, and it makes sure absolutely nothing is left to chance.
And now we get to it. The moment everyone thinks of when they think of anesthesia, induction. All the monitors are on, the full team is ready, and it is time to guide the patient from being awake and, probably a little anxious, into that state of general anesthesia.
So the first thing that happens is you'll be asked to breathe through a mask. But this isn't the anesthetic gas just yet. It's actually 100% pure oxygen. This is a critical safety step called pre-oxygenation. What it does is it fills your lungs with a reservoir of oxygen, which basically gives the team a safety buffer of several minutes. It's a huge deal. Then, through the IV, the medications start to go in, and it happens in a really fast, really precise sequence. First, something like midazolam to help you relax. Then fentanyl to blunt your body's response to what's coming. Then the big one, propofol, which is what makes you unconscious. And right after that, a muscle relaxant like rocuronium. The whole thing, it happens in just over a minute. It's an incredible, coordinated dance.
As that propofol hits your system, you might feel a little bit of warmth in your arm. And then, honestly, within 10 to 20 seconds, you're under. It's just like they say. The next thing you know, you'll be waking up in the recovery room.
The very moment a patient loses consciousness, the anesthesiologist's most critical and high-stakes task begins. Your body is no longer breathing for itself, so the team has to take over right now. This requires intense focus, skill, and precision. It's time to secure the airway. So why is this the most critical task? Well, because the #1 job is to keep delivering oxygen to the brain, the heart, every vital organ. Securing the airway creates this perfect, uninterrupted, protected highway for oxygen to get from the machine into the lungs and then out to the rest of the body.
To do this, they use a special tool called a laryngoscope. This instrument lets them gently move the tongue out of the way to get a direct line of sight to the vocal cords, which you can think of as the gateway to the windpipe. It's a really delicate procedure that takes an incredible amount of skill and a very gentle touch. Once they have that perfect view, a soft plastic breathing tube is guided right between the vocal cords. Then, a little cuff at the end gets inflated to create a gentle seal. This does two things. One, it lets the machine breathe for the patient, and two, it protects the lungs from anything coming up from the stomach. The airway is now totally secure.
Okay, so there's this myth that once the breathing tube is in, the anesthesiologist just, kicks back and reads the newspaper or something. Let me tell you, nothing could be further from the truth. Induction is just the kickoff. Now the real vigil begins.
Immediately after the airway is secure, a whole new mental checklist gets rolling. You can think of it as the ABCDEFs of keeping the patient stable. This covers all the crucial next steps, from giving antibiotics before the first incision to constantly monitoring the patient's core temperature. Let's just focus on that temperature thing for a second. Why does that matter so much? Well, check this out. Research has shown that a drop in core body temperature of just 1.9 degrees Celsius can actually triple the risk of a surgical site infection. So something as simple as keeping you warm is absolutely vital for your safety. Throughout the entire surgery, the team is also on high alert for rare but very serious complications. One of them is called LAST, that's local anesthetic systemic toxicity. It can happen if some of the local anesthetic the surgeon is using accidentally gets into the bloodstream. It's a major medical emergency, and the team is always prepared for it, with the rescue treatment literally right there in the room. And this really highlights why that constant monitoring is so incredibly important. See, an awake patient could tell you, hey, I have a weird metallic taste in my mouth, or my ears are ringing, but under anesthesia, you can't. The team has to be able to detect the most subtle changes in your vital signs to catch something like LAST before it becomes a catastrophe. They are always watching. So after going through this whole journey, from that first conversation to the complex dance of induction to securing an airway and that constant nonstop vigilance, what is an anesthesiologist's true role? It is clearly so much more than just putting someone to sleep. It's this. They are the guardians of your vital functions. They manage your consciousness, your breathing, your blood pressure, your temperature, your safety, moment by agonizing moment, so that the surgeon can focus completely on the surgery. They are your silent, vigilant protector when you are at your absolute most vulnerable.